Return demonstration, checking the vital signs.
Hello, hi, good morning. I'm Cheska Lumayag Sirondo, BSN1C, your student nurse. So I'm currently studying at North Valley College, taking up Bachelor of Science in Nursing. So for today's video, I will be checking the vital signs of my patient, which consists of, first, the body temperature, second is the pulse rate, third is the respiration, fourth is the cardiac rate or the apical pulse, and lastly, the blood pressure. Make sure that the materials needed is present during the procedure to avoid rush.
Materials: stethoscope and sphygmomanometer, cotton balls, trays, alcohols, thermometer. Don't forget to jot down notebook and ball pen. Read the chart to obtain data. Determine any previous activity that would interfere the accuracy of measurement. Smoking or oral intake of foods, fluid can false temperature reading. Checking the blood pressure.
Good morning, ma'am. I'm Cheska Sirondo, your student nurse. So, may I ask what is your name, ma'am?
My name is Hanami Apari po.
Your birthday, ma'am.
March 12, 2005 po.
So today, I will check your vital signs. So, the first thing is, prior to the conduct of this procedure, I do my hand washing. So, I also use alcohol to prevent also the spreading of microorganisms.
Bring the tray to the bedside and explain the procedure to the patient. When the patient knows what is to be done,
Check your
she will get better.
body temperature, ma'am. So, there are three kinds in measuring the body temperature. It's either auxiliary, rectal, or the oral.
Since the thermometer has been stored in a chemical solution, rinse it by using cotton balls with water in a firm twisting motion from the bulb to the stern and then dry using the same motion. Chemical solution may irritate mucous membrane and may have objectable odor or taste.
While doing waiting for the thermometer to dip, I will check your
Explain the procedure
pulse
to
rate,
gain
ma'am.
cooperation.
So second is the
It is
pulse rate.
rhythmical throbbing that results from a wave of blood passing through the artery as an heart contracts. The possible site for taking the pulse: apical, radial, temporal, dorsalis, femoral, obliteal, carotid, brachial, and posterior. Have the patient rest her arm alongside of her body with the wrist extended along the palm of the hand downward. This position places the radial artery on the inner aspect of the patient's wrist. Place your first, second, and third finger along the radial artery. The fingertips, which are sensitive to touch, will feel the pulsation of the patient's radial artery. Apply enough pressure so that the patient's pulsating artery can be felt distinctly. Use watch with second hand. Count the number of pulsating felt one full minute. Moderate pressure allows the nurse to feel the superficial artery expands and contract with each other. If the pulse rate is abnormal in any, repeat the counting to determine accurately the rate. Sufficient time is necessary to detect the irregularities or other defects. Record the pulse rate in a jot-down notebook. When the pulse rate is abnormal, no longer counting the palpitation are necessary to identify the most unusual characteristic of the pulse. While doing the pulse rate, the thermometer beeps, so must record it in a jot-down notebook and cleanse the thermometer. Accurate documentation allows comparison of data.
Okay, next one is to measure your respiratory rate. So, it is important to
While the fingertips are
measure
still in
the,
place after counting the pulse rate,
respiration or
observe the patient's
respiratory rate of the
respiration.
patient.
Counting the
To check the
respiration while
disturbance or
presumably still counting the pulse
or
keeps the patient from becoming conscious of his breathing, which can possibly alter his usual rate. Note the rise and fall of patient's chest with each inspiration and expiration. This observation can be made without disturbing the patient's bedclothes. A complete cycle of inspiration and expiration constitute one act of respiration. Using a watch with second hand, count the number of respiration for one full minute. Sufficient time is necessary to observe rate, depth, and other characteristics. If respirations are abnormal, repeat to determine accurately the rate, the characteristic of the breathing. Record respiration rate on the jot-down notebook, including abnormalities in rhythm and depth. if any.
Okay, next, ma'am, is to
Clean airpieces and diaphragm
know
of
your
stethoscope using alcohol
cardiac
swab.
rate or your
Swabbing
cardiac
action
output.
removes dirt. ROH. Evaluate fast
It's
and render
important to know
the parts dry easily.
your
Warm the diaphragm
cardiac rate.
of your hand before applying it to the patient's chest. Place the diaphragm of the stethoscope over the apex of the heart. Locate at the fifth intercostal space. Placing a cold diaphragm against the skin may startle the patient and momentarily the heart rate. Move the diaphragm to the side of the loudest. Count the beats for 60 seconds and note the rhythm and volume. Also evaluates the intensity of heart sounds. Remove the stethoscope and make the patient presentable and comfortable. A full minute count is important for accurate assessment. A longer duration helps determine the pulse, rhythm, and quality. For instance, is the radial pulse count greater than the apical pulse count? Then clean the earpiece and diaphragm with the use of cotton balls with alcohol. Then record the apical pulse on the jot-down notebook. Refer any unusual to the CI or head nurse. Record the result on the chart and TPR master list.
Okay, ma'am, the last one is to measure your blood pressure.
Blood pressure is the lateral
First thing,
force
ma'am, do you
exerted
smoke
by the
po?
blood on the
No po.
arterial
Okay, that's
walls.
good, ma'am.
Purpose, to aid in diagnosis. Second, to observe the changes in patient's condition. Place the patient in a comfortable position with the forearm supported and the palm upward. This position places the brachial artery so that the stethoscope can rest on it conveniently on the antecubital area. Position yourself so that the
Alam niyo po
means
ba yung
cause of
last
the
na
mercury can be read at the eye level, no more than 3 feet away. An accurate reading is obtained when the head of the mercury column is in direct vision. Place the cuff so that the inevitably bag is centered over the brachial artery, lies midway on the anterior surface of an arm so that the lower 5 cm above edge of the cuff is antecubital fossa. Pressure applied directly to the artery will yield most accurately readings. Wrap the cuff smoothly and snugly around the arm with the end of the cuff secure. A twist cuff and wrapping could produce inaccurate reading. Use fingertip to feel the strong pulsation on the antecubital space. Place the bell or diaphragm chest piece directly over the pulse. Bell chest spaces is more sensitive to low frequency sound that occurs with pressure release. Gradually deflate cuff all the way to zero, taking note of the first and the last clear loud sound. This will prevent you from missing the first stop sound as a result of the auscultatory gap period where no sound is heard. Remove the cuff and make patient comfortable. The first sound is the systolic BP, and the last sound is the diastolic BP. Record the reading on our jot-down notebook. Report to the CI for any unusualities.
So that's the end of checking your vital signs, Ma'am Hannah. So thank you so much and have a great day, ma'am.
Thank you rin po.